Hello, and welcome to the Friendly Pharmacy 5. Can we be like Sweden? My name is Lindsay Dixon. I'm from British Columbia, Canada. I'm a pharmacist with over 10 years experience. Okay, so a little geography lesson. There's Canada and there's Sweden. So these are the two countries we're comparing. So Sweden's been in the news a lot because they've taken a different approach to this whole pandemic than a lot of the rest of the world. So we're going to discuss them a little bit today. Let's talk about Sweden. So Sweden has a population of about 10.3 million people. They have mostly public health care. There is a small portion that is private. The amount of hospital beds work out to about 2.3 beds per 1,000, which is considered quite low. I think it's the lowest in all of the European Union. A lot of people there live alone. They don't really have many multi-generational households. Lots of students live alone. And the population of people over age 65 is 19.6%. So if you look at Canada, we've got quite a bigger population. Of course, we're larger geographically. We do have public health care. We have kind of a similar amount of beds per 1,000 people, even though it's still considered very low. Here we do have a lot of people that live together, but our demographic of people over age 65 is a little bit less than them. So that's the comparison there. So Sweden, what have they done? So what's happened to Sweden in the face of the pandemic is that schools and restaurants have remained open. Universities have gone to online only, and restaurants, even though they're open, they can't have more than 50 people, and it sounds like they are spaced out as well, as far as tables go. So they have been asked to do physical distancing. If you can work from home, they've asked you to work from home. Many businesses have remained open. They've been asked to refrain from non-essential travel. And there's been the large criticism here has been that the lack of lockdown has been, somewhat of a social experiment because no one knew at the beginning how bad this virus was. And as we're learning more, we can do more. But Sweden's lack of lockdown has been criticized, and we're seeing a lot of deaths in the elderly population there. So the question is, are the elderly paying the price for this very lax type of approach? So in Sweden to date, there are 18,926 cases and 2,274 deaths. So in Canada, as of today, we have 2,982 deaths. I think we might be a little bit ahead of them as far as the pandemic goes. However, we do have quite a larger population, so their death rate is increasing quite quickly, and so that's something to keep an eye on. This image here is just a photo of Swedes standing at the bus stop, and there's jokes saying that it's no different now than it was before. But I think this kind of could look similar to Canadians. We don't like to be very close to each other either, so. So the current situation in Sweden is that their death toll is higher than the US in deaths per million already, and they are behind the US as far as the pandemic timeline goes. Their ICUs, there are reports that their ICUs are starting to struggle, and there's this funny protocol that the elderly are less likely to be taken to ICU, so I don't know if that means that they're just being kept in their homes or care homes or what's going on there, but that's a little bit questionable. And it seems like their strategy is herd immunity at the cost of human life. So, that's interesting. So some questions that we need to ask are, what should we expect from public health? Should we expect that they would save lives at all costs? And is herd immunity at the cost of human life justified? So if that meant that my relative was to die, I would say no. And I would hope that if I heard that someone else's relative was to die, I would also say no. But these are questions that we need to grapple with for sure. Can we be like Sweden? It's a big question. I think we can be better. So in Canada, what can we do? We can keep our death rates low. We can reopen the economy with a very low cost to human life. We can insist that our government invests in a more efficient healthcare system and level of care in our care homes. And we can return to a new normal without it costing the lives of those who are most vulnerable in society. As for Sweden, time will tell. Hindsight is 2020. Let's keep an eye on them, and we'll see how it goes. So be wise, save lives, plank the curve, and you be wise to get outside and get some vitamin D. It's really good for your immune system and overall health. So that's my 2 cents for this week.